You know what you're listening to, right? 3, 2, 1.
Uzima Health and Wellness.
What the doctor say?
Welcome to another edition of What, How, Why Wednesday. Dr. K is in the house. I'm Tamara G from 101.5 Light FM in Miami, and so happy to be here on blackdoctor.org once again. Thank you all so much for having us. And this week on What, How, Why Wednesday, we're going to be discussing gunpoint. We need a ceasefire. We have some wonderful doctors. Their specialty is dealing with what happens after gunfire. We have a psychiatrist, we have a trauma doctor, and we're going to be finding out more information about truly why we need gunpoint. We need a ceasefire on blackdoctor.org. So thank you so much for joining us. Dr. K, thank you for coming and doing this once again, because truly, there have been so many topics that have affected our people and just people in general. Some of us personally on this call, we'll talk about that in a little bit. And we would love also, if you're watching, to please put any comments, any questions in the chat, and we will get to those comments before we get off tonight. But welcome, Dr. K. So happy to be with you again. Thank you for inviting me.
I thank everybody. It's good to be with everybody as we can begin this conversation. It's a very serious conversation about gun violence in America. This is one that we just had to do, and it fit with what is going on. How can we stop it? And why is this persistent? What can we do? How can we go about it? And again, why is this persistent? So every which way, we feel like this title is appropriate. Mass shootings have been on the rise since the pandemic. Talked about a lot of things during COVID. And lo and behold, we've had mass shootings after mass shootings over the last 60 days that have made the headlines. We, of course, are dealing and reeling with the painful fact that we've had another mass school shooting. We're reeling with the fact that we had another mass shooting in Buffalo where people of color were targeted simply because of race. We are dealing with an 80-year-old being shot at a graduation. And so what we want to do is now pause on this very important conversation and just reflect on it. I want you to understand that we're up 13% in mass shootings. Now, mass shootings are defined as when 4 or more people are shot. That does not mean when one person is shot in your community that it's less painful, but we've been dealing with mass shootings. But the other conversation that we had is that are mass shootings separate from community violence? Because we are seeing the fact that some of these shootings make the news, but by and far in Black communities, we have mass shootings all the time. And so we need to reflect and see where we are as a community post-pandemic and why there's an increase in these events in our communities. I was in a film festival in Baltimore. Baltimore is another hot city in terms of gun violence, and they are embarking on what they call a ceasefire coming soon. And that is when they get out block by block in hard-hitting zip codes and encourage the people of Baltimore to put the guns down. And I love what one of the gun activists said. If somebody breaks this ceasefire in 72 hours, it does not mean we failed. It does not mean that we broke the promise. That person broke the promise. So continue to put the guns down and have a ceasefire. Tonight, I will have with you 2 of the best people that I could find to have this conversation with. Dr. Rahn Kennedy Bailey, we call him RKB. He is a forensic psychiatrist. He is also the chairman of LSU Health Science Center in New Orleans Department of Psychiatry. Let me be very clear. He is the first Black chairman after 35 years to be the chairman of psychiatry at LSU in New Orleans, another city that is on the topic in terms of gun violence. But most of us know Rahn Bailey as the 113th president of the NMA. And you also may know him just as a friend, as I do, and you also know him as a staunch Morehouse man. So we have to give it up to Morehouse. He is a proud Texan. Tamara and I have found the best in Texas. We have to do that. He's from Beaumont, Texas. So I think I got all the highlights, Dr. Bailey, and you'll give some more. We also have Dr. Keneeshia Williams. Dr. Keneeshia Williams is an assistant trauma surgeon at Emory Hospital in Atlanta. She is, now let me get this right, Keneeshia, because I want people to understand your role. This is important. You actually serve as the Chief Quality Officer for the Emory Department of Quality Improvement, and that you are the Student Clerkship Director for the medical students at Grady Hospital and Emory School of Medicine. And so this is a big task that you have, also being a trauma surgeon, a surgical intensivist, and also serving on the most important committees in terms of student education and quality improvement for surgical outcomes for these big institutions. We know that Grady and Emory are the two major hubs, and Morehouse School of Medicine are three major hubs in Atlanta dealing with gun violence. So I thank you too for your time. And so, Dr. Bailey, I want to start with you because we need you as a psychiatrist to help us make sense of the senseless. Most of the time when people are shot, whether it's one person, make sense of the senseless, Dr. Bailey.
Yeah, thank you very much. I thank Dr. Outler for having me and the entire group. We've all been doing a lot of media on this issue here. It's exhausting, actually, for healthcare professionals because we all, I think, our hearts go out to that family, that community, as well as others that were not there on site, but have been equally, I think, adversely impacted by the emotional trauma of watching the violence and the carnage and the fact that it now occurs with all groups, children and women and the elderly. Three things really come to mind, and I'd love to take some questions as we go throughout the day. One, first and foremost, it's hard to have this argument, and I've been writing about, as Dr. Outler mentioned, for this issue for almost a decade now, without simply saying that until we get the issue of guns under control, the volume of guns, 400 million in America, more guns than Americans, the capacity of guns, their high magazine capacity, like machine guns with rapid fire capability, the fact that you can actually manipulate them and make a small gun or bigger gun, what's called a bump stock, and make a gun that was bought legally, illegally purchased gun because of its capacity and high volatility. Until we can get those type issues under control, we just will not be able to live in a civilized society without the fear of gun violence in everyday life. We talk about having metal detectors in certain places, airports and ball games. What if every time you went to a library or a school, for example, or a grocery store, you had to have a metal detector? The second point I'd like to make, I think it's also very relevant that this idea that certain groups are more problematic is just patently false. The reality is the data would argue that the groups that are most likely to harm or kill you with a gun are individuals with alcohol or drug dependency, drug-related problems, those who have been victims of gun violence, and those who have been perpetrators of gun violence. And none of the 50 states have laws to preclude access to or buying those type weapons. But all 50 states have laws limiting persons who have a prior history of a psychiatric diagnosis. Those are viewed as being SPMI or chronically mentally ill from accessing weapons. Our group's really only about 4 or 5% more likely to engage in gun violence. So this over-discussion about capturing the mentally ill, although there's some relevance to it, I won't say that it's irrelevant, but it's irrational to discuss that concern so much in the midst of the overwhelming evidence that individuals who actually are more likely to use guns to harm others, we put very little restriction in gun reform capability in that regard. I think that the other issue is law enforcement. We really have to, I think, have a coordinated source of activity between our society and law enforcement that we really crucially don't have now. I think we're losing the concept of safety and security and trust and confidence in law enforcement. This entire idea that law enforcement would always, if you had a good guy with a gun, beat a bad guy with a gun, falls on his face. When you saw what happened in Uvalde, when persons actually didn't follow rules, they weren't practicing, they weren't coordinated, and they didn't do what all of us would have thought you would have done. If you had a gun and you were trained in law enforcement, when children were at risk, would be to enter the building. So I think that breakdown in coordinated services by law enforcement and government is strikingly aberrant in the eyes of all of us who think that we have a system of protection that would make sense. Those, I think, are the three biggest points, I think, take-home messages for this discussion. I look forward, I think, to my other colleagues' comments today and the dialogue.
Dr. Keneeshia, Dr. Williams, you're a surgeon, so you're seeing the trauma, you're seeing the part that we really can't appreciate, just like Dr. Bailey, really, given his specialty in psychiatry, there are a lot of laws protecting whatever medical legally someone says after they've shot someone. They're going to trial. He's done that forensic psychiatry in Houston. That's where we met initially. You are also in a very hidden, unknown area. As an anesthesiologist, you and I can speak just by our eyes, and so I trained at a level 1 trauma center as well at Cook County in Chicago. I was not at Grady, I was at Grady, but not in capacity as a physician. But I know that when you're in these rooms and we're together and we are having this, working in tandem to save a life, can you speak to what you want the families to understand about your role and what you see?
Before I move on to that, I would also want patients and family to understand that I'm not only a trauma surgeon, but I also grew up on the south side of Chicago and witnessed someone being killed myself when I was a teenager. So I have a unique perspective. And so taking care of patients, trauma patients, is difficult because it affects everyone involved. It affects the trauma patient who's shot. It affects that patient's family. It affects the first responders. It also affects the physicians, the nurses, everyone that's taking care of that patient. We try to do the best we can with everything that we can. One of the things I want everyone to know is that the patient comes in, we do what we can, we save the patient. The patient sometimes has a prolonged course in the hospital, and then the patient may go home. But then we know that after that, the patient deals with psychological PTSD, alcohol, substance abuse, all different types of things that can happen with the patient, things that we try to help with. You know, one of the things that we also deal with is knowing that patients are often going back to the same environment that they came from. So sometimes we see patients that come back. And that's also very difficult because you try to do what you can with social workers. This is a multidisciplinary problem. So this is something that needs to involve physicians, nurses, counselors, social workers, family members. Everyone needs to be involved in order to help patients recover from this. And it's something that leaves a lifelong problems for patients, not just psychological, but also physical. When we take care of patients, you think about it, somewhere approximately 100,000 patients are injured but not killed from gun violence every year. So that's a lot of individuals out here dealing with lifelong complications and lifelong sequelae, not to mention all of those people within the environment that are also affected by this.
Dr. Williams, really quickly, I want you to give us the stat for young Black men in gun violence.
Young Black men are much more likely to be shot and killed or shot. Definitely disproportionate. Somewhere, I believe the current numbers are 8 times more likely than the general population. And when we look at cities like Atlanta, just cities across the country, we've seen increases, obviously, in gun violence. In Georgia specifically, of 41% in the last 10 years. Over the U.S., it's up 33% in the last 10 years.
So many people, gun rights activists, hide behind the Second Amendment. And I'm going to say they hide behind the Second Amendment because I would put big money down that they haven't read the actual Second Amendment and what the content of that says. It says a well-regulated militia. That is part of the Second Amendment. So that doesn't mean that you can run around and have an arsenal in your home or allow just anybody, an 18-year-old who can't drink, who can't do many things without having a license, but to let them to go buy 2 AR-15 basically assault rifles, and they keep trying to disguise it as hunting weapons, but we know that's not what it's used for, and then allow YouTube to have videos on there to where they can convert these guns to get more magazines. And so what's really is we are supporting, whether it's silently or explicitly, the violence being so readily available. And then we use that old phrase, the only way to stop a bad person with a gun is a good person with a gun. And statistically speaking, that is untrue. It is, I read a statistic recently that said about 3% of gun violence are stopped by the good guy with the gun because they're not trained, and there's a whole lot of things that roll into that whole process. And so basically, in summation, we're falling prey to a bunch of narratives that are being spewed out in the media about the Second Amendment, the good guy with the gun. We've got all these cliches, and none of them are actual, factual, or able to be put into real action to save lives.
Yeah, I was saying briefly, all those points are correct. And the other, say the truth out loud, is that there's just too much money changing hands in the entire enterprise. I can't read a number that's ever lower than the last number I read. It was $1 billion, it was $3 billion, now it's just many $1 billion. Yeah. So the sheer volume of guns, 400 million in America, the expense of those guns, people claim they're buying one for whatever reason, somebody breaks it out and steals it and sells it on the underground market, the price goes even higher. So I think that we have to appreciate that all the rest of it, I think, has always just been a language of underpinning to kind of keep the message going. And that's what's so shocking and surprising, I think, even when our national governmental leaders don't appreciate that and make operative change. My final point is we've always had some degree of gun control. So I like to also argue that this idea that we don't have gun control is also not true. No matter how much money you have, I have a son in the military. No matter how much money you have, you cannot go and buy a tank because the military couldn't stop you riding down Middle Street with a tank. So to allow folks to buy other guns that are too strong, and we can't really stop it because there's no gun control, and then the mortars and tanks that you can't really buy, means that there always has been some degree of restraint. We just haven't made it at the level where it needs to be to protect civilians. That's what changed.
Tamara?
I wanted to ask this question to Dr. Williams because you mentioned that obviously the person who has been shot has been affected and they're in your operating room, and then it trickles down to the family members and what happens. But for someone who has never been around, someone who's been shot or has seen that, what does that little bullet do to people once it hits the body? People just think they can get up, everything will be okay after you finish back together.
It's interesting. So the bullet, depending on what type of bullet it is, some of them will enter the body and it will completely destroy the liver, for instance. Or it hits the heart and it damages multiple chambers of the heart. I've had patients who have been shot 19 times and somehow it doesn't hit any major vital organs. I've had multiple patients that have been shot one time, and all it takes is for it to injure a major vessel in your body, the liver, major vessel in the liver or heart, for it to cause death. There's bullets that we have that enter the body and then explode. And so, again, it can be very disruptive, or they can just enter the body and pass through a path where they enter the intestines. We have patients that end up with ostomies where they're not able to pass stool normally. A number of things that the bullets can do. I've seen bullet injuries. There's no part of the body that I haven't seen injured that I haven't operated on. And I trained in Chicago at a level 1 trauma center, and then I've been at Grady for 5 years now. And I always tell people there's no part of the body that I haven't operated on except for the brain, because that's the neurosurgeons. We see great devastation.
So I want to, again, I was at Cook County, an unsettling feeling to see a child shot. We call gun violence a public health issue. It is also a health disparity issue. We call it a public health issue, again, because we see certain communities under siege all the time. And so while we can argue about finances and the logistics, where the guns come from, I thought that Spike Lee did an excellent movie called Chirac, which got controversial, and they wanted to get hung up on the title of the name, but the point was well taken. If you are from Chicago, if you've trained at level 1 trauma centers, you knew that he was on point with, his artistry and his creativity to get us to understand gun violence. What he made us understand significantly was the post-traumatic stress disorder. And I'll have Dr. Bailey speak to what that really is. And can you experience it on a community level? I think it's very important, which is what you alluded to, Dr. Williams, is this is one of the things that if you survive, even if you don't, somebody within the gun violence spectrum, whether it's the family or the victim and or both, the community will suffer from PTSD. So can you speak to that as a psychiatrist, Dr. Bailey?
Absolutely. I think we actually wrote a piece some years ago after Sandy Hook happened, which at that point was very similar to this issue regarding in Uvalde, with children being shot and killed, that the whole community would be at a risk of PTSD. For your audience, PTSD is the acronym for post-traumatic stress disorder. It is the most severe form of an affective-oriented illness, of a depression or an anxiety-based type problem. In order to get a PTSD diagnosis, one has to have had a life-threatening or near life-threatening type event, one that was actually palpable to you. I think the history is relevant. We didn't start thinking about this until the Korean War. They called it shell shock syndrome. Got the diagnosis of PTSD after the Vietnam War. But early on, we thought that it would take war for human beings to have the level of stressors that would rise to the level of creating this degree of neurobiological pathology, such as the anxiety that individuals experience. We also note, though, that some individuals have a pre-existing vulnerability to an anxiety-based stressor that might make them much more likely at risk to have chronic PTSD that'll last more than 6 months. And we see that, I think, in our offices. We see persons who struggle in many other areas of life and their function because the stressor was so overwhelming of their defenses. Clearly, these issues regarding gun violence and risk of gun harm to younger persons, children and adolescents, absolutely may put many of them, including whole communities, at risk of PTSD.
And so I think your point is well taken also that there's what we call intersectionality in communities, where it's not just one thing that's causing the stressor and then you add gun violence to it. Dr. Williams, you appreciate that term intersectionality when we're talking about getting our patients recovered and back into a society. What is your impression of that?
I think we have a lot of work to be done in that way. I think that a lot of the cities are understanding that in order to get patients recovered and back into the community, they need a multidisciplinary team. This has to be a hospital-based violence program that includes physicians, community workers, social workers. Now you have cities where the mayor's office, for instance, in Atlanta, we have a violence reduction program. Now you have clinicians involved in that program to help kind of coordinate what happens to patients once they leave the hospital, helping them recover in the community, helping them navigate and helping them find jobs, for instance, resources, things that we know will help reduce violence, helping reduce the amount of retaliation that we see after these events. So all of those are, the responsibility, really, to me, the responsibility of the trauma surgeons across the country, the people who are working with the patients, the social workers, and then also the city council, the highest of the high. We all need to work together.
Yeah. Dr. Dean, tell us.
There was a time where I worked in the Atlanta public school system. I worked with teenagers. And what I noticed is that social media plays a role in the escalation of violence. And what I meant by that is that we would have fights in the school, right?
Yeah.
So high school, there would be fights. But what was happening is the kids were recording the fight, right? And then they were putting the fight on YouTube. And so now that person that lost that fight, had to face the shame of losing the fight, but then also had to face the multiple times of people watching it, putting comments on it, being ridiculed over and over and over again, because now it's public. It's on World Star, and everybody's sharing it on their phone. And so now you can't go to, I got to get revenge with the physical, I've got to escalate to get my respect back, to get my name back, my whatever. And so they would escalate to more lethal forms of violence in order to get that name back. And so the escalation is being, in part, I'm not going to blame social media because you take it as it is, but the escalation is in part being fueled by social media.
Dr. Bailey, that leads me to comment on one interventional strategy, and that is conflict resolution clinics, conflict resolution support systems, either connected to the hospital or out in the community. Have you seen these strategies work?
I have. Again, literally doing a lot of media on this today. I think your show is excellent today, Dr. Outler. Literally, I was on a show yesterday. We were discussing the fact that people need resilience. And I think increasingly we have a society where all too often a critical mass of too many younger persons, adolescents and early adults, and even some persons who are approaching middle age, unfortunately, in my opinion, don't have any degree or a substantial amount of resilience to address various forms of conflict. Solution programs, as you point out, I think correctly, work to give an individual some experience, hopefully build some confidence, to build some strategies that I think build some defense mechanisms to be able to manage difficulty, conflict, disrespectful events, so to speak, without having to, I think, as Dean Ellis says very, very articulately, having to escalate the problem. People walking away. We talked to persons about finding 3 strategies that you can engage in that allow you to do something other than fight back, whether you go and read, whether you go for a run, whether you exercise, whether you go and talk to a close relative, whether you go and do something else more proactive for yourself. But it can't be that you stay in that one space. And psychologically, the only thing you can do is win in that small square of engagement where they hit you, you have to punch them. If they punch you, you have to stab them. If they stab you, you have to shoot them. Getting out of that space psychologically, I think, is a long way toward developing conflict resolution skills. We, I think, as a society, now we have to take on a much larger responsibility in doing this for many, many more persons. Because also, we recently discussed, well, where are families and where are parents who have you? And that's often the age-old, axiom to argue against when we have societal problems. And that's an issue, I think, for itself. But the reality is government and professionals like ourselves can have a role to play and can, I think, have a very valuable skill set to impart to other young persons to help them before they get to a point where they have a conflict and they've shown that they don't really have a capacity to manage it nonviolently.
Mm-hmm.
Emotional regulation is the key. And that was one of the things when I was counseling teenagers, we had to teach them emotional regulation. So you get angry, how do you manage that? How do you deal with that? Critical thinking, being able to handle multiple realities simultaneously and see it all the way through to the outcome. If I do this, then this can happen. We've got to be able to teach our children that again, so those are some of the skills that I see that are lacking, particularly in poverty-stricken areas where there's low emotional regulation, low critical thinking ability. And so therefore you go to stimulus response very, very quickly, and they forget that there's a freedom to choose your response every time there's a stimulus. And so if we can teach our population as a whole those skill sets, I think we can de-escalate some of the violence and what's happening outside of what's happening in some of the conversations about gun control.
We also need to tell them that there's always consequences too, because when you
there's that piece too.
You make those choices, you've got to be prepared for the consequences. When Dr. K asked me to be on to help co-host this, she wanted me to tell a personal story and try to get through it without crying. But one of my classmates was killed about 2 weeks ago. He also made national headlines, Dr. John Chang in California. He was the doctor who saved everyone else at the church. You just never think that it's going to hit you or someone you know, and especially someone like John Chang, most likely to succeed, had a wonderful practice in LA, always came home to East Texas for our class reunions. We're celebrating our 35th. I know it looks like I just graduated last year, but celebrating our 35th this year. And he won't be there because someone walked into a church and wanted to shoot up the place and kill everybody inside. And I asked this question to Dr. Williams. And I don't know if there's even an answer for the mental illness part of it, because even the 18-year-old in Buffalo didn't exhibit anything that would make people think that he would buy a gun and then shoot up a grocery store. The same thing with the 18-year-old in Texas. He bought the guns legally. He passed the background checks. Everything is great, but it's really not great. So how do we know when it's not great?
I'll answer the best I can. I think that we've always talked about mental illness and gun control. But what I think that we're seeing is a lot of the people who are some of the mass shootings that we're seeing recently, and some of it has been linked to, I don't say the critical race theory, but the theory of superiority.
The great replacement.
Thank you. The great replacement. And so I think that we've always thought of it as something that's mental health issue. But I think we're seeing more and more that it's not necessarily a mental health issue, although there's some component of that. But as you said, a lot of the shooters, there was nothing that anyone would have thought. And I don't know the exact answer, but I can say that, looking at some of the literature and having spoken to people, that's more so what we're seeing now.
Dr. Bailey, I'd like you to answer that too. How do we know that something is brewing in their heads, that, when you're invited into a church and the people have welcomed you, you've been there before, really you were casing the joint. Same thing with the grocery store.
Yeah, I think that Williams' points are timely. The reality is we are in a period of iterative change. And I think, as we said at the very beginning, there are three take-home messages, I think, for your audience. One, first and foremost, having chronic mental illness, having pre-existing brain-related disorders, being diagnosed and treated, hospitalized, medications, all that kind of business, does put some individuals at a greater risk of being engaged in violent actions, probably about 3 to 5% more than the typical population. The reality is, though, those persons are more likely to be victims of violent crime, especially gun violence, all kinds of violence, a homicide, a sexual assault, and the like, than they are perpetrators. So the entire discussion about those being mentally ill, when we have these huge outpourings of emotion because of shooting this nature, really kind of allows, I think, society, in my opinion, and government, is where I point my fingers, to really advocate the responsibility to engage in the kind of policy development that our society really needs to provide real safety. And that's because the individuals who are much more likely to engage in such difficulty, very often these problems are interpersonal. They're very often with people that we know. You have a gun, and when there's a conflict, you grab a gun very quickly. The third thing I'd say, though, is I do think there's a new, unfortunate, additional variable and it may not only these last two cases in Uvalde, Texas, and Buffalo, New York, but these kinds of cases. Many Americans should be aware, we've had more so-called mass shootings in America this calendar year than days in the year. We used to describe a mass shooting as 5 or more. Now it's 3 or more persons shot in one setting. So clearly it's more than just a history of mental illness. Clearly, I think having access to guns of mass destruction, I'll call them, plays a role. You can hurt so many more people in a short period of time. But I think a third issue is we absolutely have individuals who don't have prior psychiatric illness, diagnosed illness, who are choosing volitionally and intentionally to engage in an unacceptable, violent behavior toward others who they don't really know. And that's scaring the world out of me and the rest of us, because you wonder, where can you be safe if somebody, I think you said very correctly, Tamara, if you go into a place that somebody you wouldn't have thought would have done that and they're going to do it. There's so many individuals then, it widens the risk ratio of individuals who might hurt others. That piece we've got to work to get our hands around. And I'm the first to say we don't have a good idea how to handle that just yet as professionals. But we need coordinated services, we need government, we need healthcare, we need universities to be involved. We need to really think through in a better way. The issue of decreasing the amount of guns is one consideration, but how to intervene early on persons who may be beginning to think psychologically in ways that may put others at risk, I think is also a strategy that should be on the table. We've got a lot of work to do.
It's a uniquely American issue, Dr. Bailey. I just want to make that point, because I think we're losing. When we look out around the world's looking at us like, okay, this is a uniquely American phenomenon.
Both and Britain, I hate to keep jumping, I apologize, but both can have passed federal legislation since Uvalde happened, and we still can't have a discussion in the U.S. Congress. Both countries have already passed the bill to strengthen the gun reform that they already had. So this can be done. Our problem are our federal and state legislators.
I want to, since you brought that up, the question to each one of you, Dr. Bailey and Dr. Williams, COVID has produced a vacuum of funds. And so while we were talking about all these resources that are needed, can you please speak to what you want to do, Dr. Bailey, in New Orleans, the program you have, and yes or no in terms of funding? And then Dr. Williams, I'll ask you the same question.
Well, I'll be brief. Well, clearly, as Dr. Outler knows, we tried at LSU, we made a 150-page proposal to take over the clinical care, medical and psychiatric, at the Orleans Parish Prison. I'm very public about it because we did get it, and I think it's really instructive, because the reality is, we wrote a proposal that would have provided the kind of advanced, progressive engagement of young men, very often young men, 1,000 people in jail there, unfortunately 93% of which are African-American, that might begin to provide the kind of treatment that's needed to de-escalate, to use I think Ellis's points earlier, and to modify some of those strategies that people very often don't have. Many people go to jail early on with a non-violent offense. They get out of jail for whatever reason, they then engage in a violent offense before they actually go back. We need to find some strategy and some location, and I think jails are a very good place to do so, early in the violent action or the criminogenic type action of young men, to begin to find ways to address it. And one strategy that I talked to Dr. Outler about was we were going to do an ACEs, one of these adverse child life experiences on everyone, because I believe in this comment, hurt people hurt people. So many individuals who've been emotionally or physically or sexually abused or harmed when they were younger are ripe to become the individuals when they're older, late teens and young adults, to engage in violent acts toward others. We can't wait for that violent act to then put them in jail and put them in prison and try to be punitive toward them. I think strategies to employ some psychiatric maneuvers early may be progressive, hopefully maybe a bit more forward thinking, and can be helpful. New Orleans is beginning to show some attention to it. We may get this 200-bed residential treatment facility in the old VA hospital. We have some proposals on the table in New Orleans that I hope will come to fruition. And I think over time, we may be able to make some successful gains.
Maybe that'll be a model for other cities. Dr. Williams, what are your community interventions looking like? I know we have the Violence Prevention Center in the School of Public Health. I'm a graduate of the Rollins School of Public Health. And do you have funding? Because we can talk about this, but do we have funding?
So we do have funding. The city of Atlanta has dedicated money to this problem. We've seen a uptake in violence, and the city has recognized that, and they want to put things into place to improve that. So at the end of last year, the mayor's office really put out statements. One of those things was they want a hospital-based violence prevention program. Grady has had programs, and one of the things that we're looking to do is expand our program to work more with a lot of the individual programs that exist, because there's a lot of programs that have always existed. But what happens sometimes, and especially in major cities, is that you have a lot of programs that work in silos. But it's important for those programs to work together in order to have the most impact on the community. And so that's what we're trying to do. The other thing that I look to do in the future and that we're working on is really creating a community outreach, so that we're getting out and reaching students, reaching members of the community when they're young. So going to the elementary schools is important, going to the high schools, talking with students, making sure they understand the impact of violence or what can happen, and make sure they understand their options, make sure they have, role models. And so that's what we're looking to do.
Question, you're walking around Atlanta. How do you feel in terms of the atmosphere? And I love to go to Atlanta. I love to just hop on the plane and just walk about freely. I know every point. So my question to you is, as a Black man with a son walking around, and even just thinking about places, do you have any thoughts about that as you walk around the city of Atlanta now?
I do. I think there is a privilege that even as a Black man, I enjoy being gainfully employed, having an income that can have me living in areas that are safer in the city. And so therefore, there's that piece of it. But I would be remiss to say that not everybody can do what I do. And so I recognize that as my privilege. And so what I think we need to do, and I'm just speaking as a layperson here on this panel, is that more men and people that are educated need to just go talk to some kids, right? Go be an influence. Because one of the things that I missed the most about not working in Atlanta public schools was I was there. I saw the gangs. I recognized what they're doing, but I had the opportunity to engage with a young man at a much deeper level. And to this day, some of them are still living productive lives, and they moved away from those gangs, moved away from that violence. And yeah, they're not all going to college and all living, but they're being productive citizens and they're not engaging in violence. And so we have to I think one of the biggest travesties that was done in many school systems was taking vocational education out of schools. Yes. Right. Yes. And so, because if you don't teach somebody how to work, and college is not for everybody. And I would drop this statistic when I would be fighting with administration, and I would say, when we're looking at the school I worked with, 25% of students were going to college, 25%. 20 to 25% were dropping out. So that means the middle percent were graduating from high school, but they were entering the workforce without a skill set because everything in the classroom was taught as college prep. Mm-hmm. So you're only reaching a quarter of your student base. I said, you need to be focusing your energy on that 50% of students that are going to graduate and go to work and leave the school and go to work. And then maybe that effort of trying to save those kids that are going to drop out. Mm-hmm. 25% are going to go to college. A lot of them already have. When I would talk to them, they had parents in their home. They had people around them that were going to support them. They were going to make that college jump. There's a few, about 5% that teachers can influence, but 20% they were already going to go to college. Focus on getting those people work that could be gainfully employed so they can get out of the streets, get out of, because what I was seeing when kids would graduate and they didn't have jobs, they resorted to crime and violence, followed very, very closely after. I got kids that I know personally that were in my classroom that ended up being killed in Atlanta because they were joyriding, they stole a car, joyrided, and ended up getting in a car accident, running from the police. And I had to read about them in the paper. That's the real life situation of it. We have to expand our role as Black people to understand that our community, even though we may not live specifically in the community, it's still our community, and we've got to go in there and be a positive impact on that community. I'll get off the phone.
But I have to say this because I grew up in Houston and we had schools that were focused. It's more than a job. It's about the fact that you left the day feeling like you had produced something, that you had some self-esteem and some self-worth. And so, I was in the magnet program, but I was always jealous of the kids who were in home ed. And I would think that, they left every day feeling that they were smart, that they had creativity, that they produced something of value. And while I was the smart girl, as they say, but I never left the day feeling, that I had something tangible. And for some kids, that is vital, that is important. So, we argue about certain programs and, this is, this makes people think that this is all that they can do. I mean, I did some testing and one day it said, these are your best occupations, clerkships, beautician, what have you. That didn't make me feel less than. I just said, okay, great, I can do this and I can study hard. But what I know about kids that learned how to do home ed and vocational programs, Eaton Worthy School for Cosmetology, Lamar School for Law Enforcement, they left with some type of direction and some type of goals. And I think that that's also, to your point, Dean Ellis, that we do need to make sure that our kids feel that their life is valuable and that there's something to work towards and there's a future out there for them to have. And I think this Dr. Bailey will attest to that people need to feel hopeful.
I fully agree. I think that Ellis's points, all three of them were timely. One, I don't think they doubt. We won't be able to find a way to address. We don't find a way to get more Black men in the circle of influence with young Black boys. Whether you are their biological father or whether you're their Little League coach, if you play Little League sports like I did, Little League baseball, or whether you're at the Y or the path, whatever the case may be, people have to have role models. You have to see what other people look like you do. I think it's a very timely point. The other issue is also true, though, this idea that I think Dr. Outler points out. The reality is people should feel that there's a practical validation to your day, let alone your week and your year and your whole high school experience. And I think you're right. We all are recognizing that many young people drop out because they feel like there is no validation to their day. It didn't matter if they came or didn't attend. If all the attention is just on the people who are in the magnet program or in the private school or whatever in that case may be, we have to, as a society, you're right, I think, Dr. Outler, find some relative importance and create some valuable aspects of institutions, I think, for all the others. I didn't know the number was 50%, as Ellis points out, and that's actually well stated. If half the people there are not going to either go to college or they're not going to go to college to do these grad programs like many of us, if you will, or and a fourth are going to drop out totally, you really should be teaching to the mean, to the half that are going to finish, get a good, solid high school education, and be a productive member of society with a skill set that allows them to address a job that really matters. We're missing a lot of that and losing a whole generation because of it. And then we wonder why so many people resort to these little 5 and 10 cent, penny ante, nickel and dime crimes. And then we arrest them, and then you're on probation, you violate your probation, then you get a better difficulty, and somebody gets popped. They call it the laws are against you. It's a drug offense. It's a vicious cycle for too many people who are unresourced and uneducated and unsophisticated in our society. And then they end up being a victim, in my opinion, very often of a system that over-criminalizes them and makes them part of the criminal justice system. So people like us have got to find a way to break through this. I've been talking politics a lot tonight, but there may be some other strategies to use as well. But there's got to be a way to do this thing better. And it shouldn't be we wait until the end of the spectrum. That's why it pulls out an AR-15 and kills 20 people. And all of a sudden, I think our society says we got to do better in these areas. All of these areas, I think, very often are circumspect in this process.
All right, we're going to go to some of the comments and questions that are now in the chat. Marvin says that Ellis, you hit it on the head, no vocational education. So
that's a piggyback on what Dr. Outler was saying about having value, right? People need to feel value. We know from a psychological perspective, people need to feel value. And so what Dr. Bailey was mentioning earlier about doing that risk assessment on kids and going back and finding, okay, were they abused as a child? And that erodes that feeling of being valued, that self-esteem. And when you don't have value in yourself, you rarely see value in other people. And so that makes it easier to pull out that gun. Hey, I don't care about myself or my own personal safety, so why should I care about yours? And then therefore we have the escalation of violence. So we really have to find the value in ourselves, find the value in our children, help them understand what their value is, and they can walk stronger and taller, knowing that they have some worth.
To ask Dr. Williams this question, because before we started the chat and had everybody on, Dr. Bailey had said that really a lot of the crime and a lot of the gun violence happens with interpersonal. Yes. It's somebody somebody that you live with, somebody that you love or whatever. So are you seeing this, Dr. Williams, as a disparity issue, or truly is it a gun issue? Like too many people have guns, regardless of whether
I think it's both. I think it's a disparity issue, right? There's a lot that goes into it. There's a lot of domestic things that happen. I see the domestic part of it all the time, or like you said, the conflict, where there's conflict between people. But also there's a lot of guns. There's a lot of guns on the street, and you have people who, one of the things that happens is that people who are exposed to violence have higher likelihood of engaging in alcohol or drugs. And then those people, if they have guns, have less inhibition to using those guns. And so sometimes those guns are used on their siblings or wives or husbands, or there's a lot of domestic or acquaintances that maybe they would not have otherwise. But, there are a lot of guns, and we're seeing more and more people that are buying guns. There's more guns on the streets, and then the amount of crime or gun incidences have increased by 33% over the last 10 years in the U.S. And so, you look at other countries, you have other countries where sometimes the domestic dispute it's a lot of stab wounds, for instance. There's a lot of knives, but I think part of it is, it's both. I think there's a lot there. Both have to be. I don't think you can just focus on one. I think you do need to focus on the amount of guns that are in the community, but I think you also have to focus on why someone would choose to use the gun in the first place. So I think there's that both.
Dr. Bailey and Dr. Williams, I want to close the show by having you both, and I know we have like a few minutes, but what is your message for gun violence? What is what is your one-liner? Dr. Bailey and then Dr. Williams.
My one-liner is we have to, as a society, coordinate services, decrease access to violent weapons, while at the same time understanding better the emotional fragility of many of our young persons and finding ways to help them modify impulsive considerations that may lead to the overuse of violence. People need better resiliency, better defense strategies, and better mechanisms to manage conflict in a nonviolent way.
Dr. Williams?
Yes, I agree wholly with Dr. Bailey. And I would say that this problem is pervasive and needs to be taken with all seriousness by everyone involved. So from the highest level, it's from politicians. I think there really needs to be a closer look. Well, there's two different things that happen. You have mass shootings in school, and then you have the community shootings, right? Those are two different things, and there needs to be a focus on both of them. Some of the instances that lead to them can be similar, but we have to focus on both, and everyone needs to be involved, and it's really a public health crisis.
I think that what I would like to encourage people to do, again, Dr. Williams, appreciate as an anesthesiologist, you and I, in terms of our roles, definitely have reached in and had to lock arms to save a life. And sometimes we don't save that life, again, but all efforts, everything, every resource that we've had from blood and what have you, the surgical skills, sometimes it's not possible. And it does affect us as physicians. It is a hurtful feeling. And I can tell you that I've heard the scream of a mother who has lost their child to gun violence. It is a blood-curdling cry that there is no soothing for. And so to walk out there and have to give that news is just awful. My one-liner is, if you can put the guns down, put them down, that we need to lock arms in terms of our churches or whatever community organizations, and we need to safeguard our youth and give them options on a daily basis on how to resolve conflict. There's too much normalization on Instagram, on YouTube, on what it looks like. And I want the new generation to understand it's not pretty. Dr. Williams alluded to the fact that, yes, you can survive the gunshot. And yes, you can be paralyzed, and you can have a colonoscopy. You can be in a wheelchair. You can have bed sores. So understand that is not something that you want. We want you to be productive. We want you to be happy, and we want you to live, be a contribution to society. And that's a good thing. Ellis and Tamara, you all can close the show. And I just appreciate both of you all for being here.
Thank you for everything. And Ellis, I'll let you get the last words, but I also do want Dr. Bailey also to please hammer home about getting some mental health, because we just don't believe in that for whatever reason. And there's, it's nothing wrong with seeking help.
Well, I just simply say you're 100% right. I think that formal psychiatric investment very often eludes us, I think, in the African-American community. But as I like to say, I've been a 32-year practicing psychiatrist, and I promise people on this panel and my friends everywhere, Black people do go to the psychiatrist. They just don't put it in writing. They go to their primary care doctor and ask for psychiatric medication, or they wait until there's an emergency and go to the emergency room and ask the emergency room doctor for psychiatric intervention, or they go to a non-doctor, a therapist or what have you, and ask and discuss the issues and the problems. So you're 100% right there. I think that it's this concept of being a psychiatrist, an MD with behavioral health training, that unfortunately our community seems to be afraid of, stigmas against. But we, like all other communities, have brain-related disorders that at times require therapy, medication intervention, and hospital care. So the reality is we should walk away from that stigma so we can get care, get it early. I like the fact that Ellis picked up on the comment about the ACEs. That's what happens in any other clinical setting where you go. Somebody would find out early on if when you were a child, you hit a 6 on a scale of 1 to 10 on this ACEs scale. If you hit a 6 on that scale, all kind of resources should come to you because you're at a high risk of adversity, of ongoing psychiatric difficulty and diagnosis, and maybe even being a victim, the Lord will perpetuate of violence in the future.
Well, we'll let Ellis, and you wanted to say some words too, Ellis, before you leave.
Yeah, I will say that, and Dr. Bailey alluded to it earlier, there's big business in violence. There is big business in guns. There's big business in prisons. We understand, like I talked about, what's the wording in the Second Amendment is. The wording in the 13th Amendment is slavery shall not exist unless you are incarcerated. So there is big business in all of this. So what do I mean by that? So number one is we've got to take control of our lives in our community. We cannot expect big business to stop being big business, and we cannot expect big business to stop paying politicians. We have as much control over what happens in our communities as what happens in DC, what happens in your city government. We have more control over that. So we've got to make it our personal responsibility as a community to say, you know what, we're going to go in this community. We're going to give value to our people. We're going to be there to influence them, and we're going to take charge of that. And yes, and vote, right? Because people say they're not going to do anything. Vote them out. And we have that power. So we've got to take our power back, go in our communities, vote, join the NRA, vote out the leadership now, vote them out too, right? So that we have power. Let's exercise our power and not be so powerless.
Thank you so much for joining us for What, How, Why Wednesday. I'm your co-host, Tamara G., along with Dr. Kendra Outler. She's an anesthesiologist in the D.C. area. Again, gunpoint, we need a ceasefire. Thank you to everyone who's been on. Dr. Rahn Kennedy Bailey, the head of psychiatry at LSU, also the 113th president of the National Medical Association. Dr. Keneeshia Williams, Emory University, also Grady trauma surgeon. And we also have Ellis Dean, who has been our technical person tonight, helping us with blackdoctor.org. So thank you for giving us the platform. Speaking of platforms, don't forget to go to Dr. K's health and wellness platform. It's called myuzima.org, myuzima.org for more information and more of these that we're going to be doing. So thank you all so much for being here tonight. And until next time.
Thank you so much.
What the doctor say?